Right, let's take you back to Pietermaritzburg now. That's where unemployed doctors have been demanding that the Provincial Health Department fulfill its promise of giving them jobs by April. Let's take you to our reporter. Newzroom Afrika's Nobuhle Modise has been monitoring this story, and she joins us now live. Nobuhle, so these are doctors who have fulfilled their community service obligations, and they've been waiting since then for their appointments.
Michelle, you'd remember in February they did march to these offices here at the Natalia building in Pietermaritzburg with their demands, and today they are saying that the government, specifically the Health Minister Dr. Joe Phaahla, as well as the President of the country, Mr. Cyril Ramaphosa, had promised that they would be hired come April, and it's now April and nothing has happened, and this sit-in is now on day 4, and they are saying that until their demands are met, they will continue to sit outside the Natalia building. Let's listen in on that press briefing that they're about to have.
Thank you. And greetings to colleagues and the members of the media. Today marks the 4th day of our sit-in, and as we gather here today, it is important that we reflect on the reasons that led to us being brought here. So in summary, our sit-in follows the march that we had on the 12th of February 2024. That is almost 2 months ago. With no response received from the KZN Department of Health within the 2-week time frame which we had stipulated. Despite our efforts to reach out to them, we have not seen any progress in recruitment. While there has been assurances from the Ministers of Health and of Finance and the President regarding the hiring of doctors by the April 1st, the reality on the ground paints a different picture. The queues in our healthcare facilities continue to grow, with cancer and surgical patients facing long waiting lists for intervention to restore their mobility, their healthcare, and most importantly, their dignity. In light of this being the year of general elections, we are wondering if this was merely a political move to capitalize at the expense of the basic human right to healthcare. Our interaction with the head of department on the 2nd day of our sit-in, when contrasted with the media briefing by the MEC, Ms. Nobuhle, highlighted a communication gap between the national and provincial structures. There are conflicting messages from the two, with possible explanations ranging from either mismanagement of funds to deliberate fabrication of information. It would be remiss of us not to condemn the MEC for audaciously hosting a grossly misleading media briefing, since she never extended us the courtesy to meet with us and listen to our grievances. This is despite our multiple attempts to obtain our audience, and our endeavors are reflected by the trail of the emails that we have. As we prepare for our upcoming meeting, which is scheduled to be this afternoon at 3, it is crucial to address a few key points. Firstly, reflecting from our initial march in February to our current stance of the sit-in, we have received humbling support from various political parties, trade unions, and organizations, and for that we are grateful. Nevertheless, we wish to denounce the notion that our cause is politically motivated. Our movement is purely driven by the urgent need to address the poverty of healthcare in our public facilities through staffing. This is not aligned in any way to a political agenda. We also wish to challenge the perception of entitlement associated with our cause. Unemployment in general and unemployment of skilled professionals like educators, engineers, allied healthcare workers, and nurses, amongst other professions, should not be normalized. Unemployment should be abolished and should not supposedly increase at a decreasing rate. The Hippocratic oath which we took with our hearts on our sleeves dictates that we remain members of the society before we are doctors. It is for that reason that we are here today, to stand up, to challenge the status quo, and advocate for the society to which we render essential services. Let us all stand united in our quest for a healthcare system that prioritizes the well-being of both the patients and our healthcare workers. Ladies and gentlemen, we thank you.
All right, an impromptu briefing there by the doctors that have continued with this sit-in for the bulk of the week. I understand that more than 100 of these doctors took to the streets in protest against the promise of their jobs not being fulfilled. They have fulfilled their community service obligations. They're now waiting for appointment, and this has been a discussion with the health department for over 2 months. This is the 4th day of the sitting. There is a meeting taking place at 3 o'clock this afternoon, so hopefully there'll be more clarity around what the way forward is then.